Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Thank you for staying with us, and definitely we are looking at our every month in conjunction with Cornwall Cancer Foundation. We're looking at cancer, the care, and also the reaching out, the education of what all that means. I heard about the syntax earlier, Denise. I'm looking forward to this conversation.
Good morning, ladies and gentlemen.
Good morning.
How are you? Nice to see you. You're looking very bright, and I'm getting the sun back. Good morning.
Good morning.
Good morning. Over to you.
Yeah, all righty, let's go. Good morning, everyone. Good morning, viewers, and thank you for joining us again as we talk about cancer and in the Nigerian space. Today, we have in the house Dr. Pamela Ajayi, who will be joining us to discuss this. So Dr. Pamela, good morning. Thank you for doing this for us this morning. Can you hear me?
Yes, good morning. Can you hear me?
Yes, we can. Thank you very much. Good morning. Okay, so let's hit the road going, right? Are you good? Okay, the first question I've got, so I'm going to give you a briefing because we're talking today about syntax and where it goes. So let me just give you a brief. A lot of Nigerians live below the poverty line, something we all know about. And certain policies and structures have been put in place to help cushion the hardships faced by Nigerians in accessing healthcare. So where we start to look at it here, structures like the NHIS, the Cancer Health Fund, and now the syntax have been initiated. So today, I would like us to be talking about and discussing the impacts and benefits that cancer patients need in forging forward on this journey. So the focus, although it's all about this, we want to look at it as it impacts on the cancer patient. So the first question I have for you is, how would you rate the scope of NHIS coverage for cancer patients? And in your opinion, what is it adequate? In your opinion?
Well, thank you very much for that question. It's actually a brilliant question, and it actually needs to be approached from 2 points of view. The first is the NHIS coverage in itself adequate? As in, is it covering enough of the country? And the answer there is no. I do not believe we have even up to 10% of the country covered by insurance, health insurance, as we speak. So in actual fact, we have not got adequate health insurance in the country, and that has a huge impact on healthcare. And specifically, the coverage of cancer within the NHIS is in itself another issue. Prior to now, there has been very little coverage of cancer and cancer treatment within NHIS. In fact, it wasn't covered. But as Professor Sambo, who is the current head of the NHIS, has introduced certain new treatment modalities and coverage into the NHIS. And I believe now cancer treatment for breast cancer as well as prostate cancer is available. And I understand that radiotherapy is available, and there's certain arrangements have been made with drug manufacturers, for example, Roche, to provide subsidized care, subsidized targeted therapy for patients. Now, what that means is obviously that patients still have to pay for some of the drugs, etc. So is this adequate? The answer is no, because number one, it's only targeting some cancers, not all cancers, and certainly not, so this is commendable because it is a step in the right direction, but certainly a lot more needs to be done.
Thank you. That's a fantastic introduction for us going forward on this conversation today, because it gets more complex now. So how much is the Cancer Health Foundation? I have three parts to this question. What has been released? And is there any trail or evidence of the usage as it benefits cancer patients and carers?
Okay, the Cancer Health Fund or the Catastrophic Health Fund is something that was advocated for actually by the Healthcare Federation of Nigeria members and other stakeholders, and took some years in the making. Started off with the Catastrophic Health Fund. I do know, I'm aware, that in the 2020 budget, approximately 740 million was appropriated and released. In 2021, another 300 million was appropriated and released. And in 2022, 600 million has been appropriated. So when we're talking about what has actually been released, is about 1 billion naira. Now, this is the money that has been released, but has it been used? That's a whole different question. I'm sure some people will recall that recently, towards the end of last year, our distinguished Senator Oloriegbe, who was the chair of the Senate Committee on Health, actually came on television and demanded for this money to be used for cancer health patients. Now, what we are aware of is there has been a call by the Ministry of Health, and the money has been selected for disbursement to some tertiary hospitals, but has actually been used. I know people have applied for it, but the evidence that patients are actually using this money, that's not clear.
Okay, I don't want to. I'm going to try and keep us focused on this, because to me that's already a serious cause for concern, which you would appreciate because of my understanding of the care cancer patients need.
Certainly, because if, for example, a cancer patient applies for these funds and it takes time before it is released, I don't know if I need to explain that, but once a patient has cancer, the risk of spread and of worsening is constantly there. So treatment needs to be timely. Treatment needs to be given as soon as possible, and the patients can't actually afford to wait. So the process or procedure, or whatever the problem is in terms of disbursing these funds to these patients or for these patients' use, really needs to be corrected quickly, so that patients can benefit from these funds that have been allocated for them.
Okay, thank you. Now, I'm going to bring up another one that, you see, everything is, no matter what, the treatment, the disease is very challenging on its own. Families are impacted significantly by the impact by cancer. And now, well, we hope, or I don't know, you're going to educate us today. Could you enlighten us about the concept of the sin tax? Yeah, that's it. So I'm going to make everybody understand there are two words, sin and tax, right? Not one word.
Yeah. So sin tax is also known as a health tax or pro-health tax. And what it is a tax imposed on products that are supposed to have a negative public health impact. So these are taxes on things like tobacco, cigarettes, alcohol, sugar-sweetened beverages, which is the most recent one that has come out. And the primary objective of introducing this kind of health tax is actually to improve population health through reduced consumption of these unhealthy products. That's the aim of it.
Okay, so now we're into the big discussion, right? Sin tax has been recently introduced for this purpose, to increase funding for health. Do you see, now this is detailed now, do you see implementation challenges, especially as regards to, you see, I will always narrate back to cancer patients. So, especially in that context.
Yes, I think what needs to be understood is these sin taxes are collected by federal, and health is actually by the state. constitutionally. So there is a challenge. And I would actually emphasize this greatly because we have had such quote unquote sin taxes imposed on tobacco and alcohol before, but the money never actually got into the health sector. So the Federal Minister of Health, she said that this money is for health, but exactly how it's going to get into health is not clear. And that needs to be clear so that we can see exactly how this money is being collected and its flow into the healthcare system. Because this has been done in other countries. So, for example, in the Philippines, this kind of earmarking for health came, and they have actually used it amazingly to triple resources for health over a period of 5 years. And they've also used it to decrease smoking prevalence and improve equity by expanding the coverage and paying for health insurance for the poor. So these taxes, if properly utilized, can have such a positive impact. But it's not enough for people to just say it. It must be very transparent, and we must all see exactly how this money is being used for healthcare.
Okay, now thank you, because I'm coming back to see now this is where I'm coming back to. So I'm going back to the same question. What is the evidence of the trail of this money on towards cancer patients? Is there a trail? I mean, you introduced us, which was fantastically done, with the figures that should be accessible to cancer patients. Now, if we've got those figures, and where's the evidence? Because people are dying of cancer. How, you get what I'm trying? How are we getting there? That's very key.
Yes, I think these are the challenges that we have right now. And I would also want to put forward another challenge before I even try and address that subject, which is a very difficult one to suggest. The issue being that the Cancer Health Fund is in a pilot, supposed to be in a pilot phase. They've earmarked about 6 tertiary institutions to actually utilize these funds, and they're supposed to have dispersed it. But it's not just supposed to be used in the public sector. It's also supposed to be used in the private sector. It's supposed to be actually an avenue or a mode through which we actually bring the public and private sector closer together. We talk about public-private partnership, but one of the words we are trying to push for is actually public-private integration, because there should not be a public system and a private system, and both of them apart, but there should be one system that works, because it's one population we all serve. It's one group of people we are looking after. And so that everything should work together for good. We have excellent cancer centers in the private sector, state-of-the-art ones for that matter. How do people get access to this, if not from payment from funds like this, to enable them to get access to the best cancer care that is available? So this is one aspect that also needs to be taken into consideration. I think what I'd like to call for is again, stronger advocacy. We need to call for more transparency. We need to know exactly what is being done. We need to know who do we hold accountable in this system. Who do we say, hold that person and say, tell us, you are responsible. Tell us how many people have been treated. Show us the evidence. Show us what is happening. Where can people go to? If I have somebody who needs care today, how can they access this money? How quickly can they access this money? Do they have to wait 3 months, 6 months to access this money? Will they still be alive by the time this money is made available to them? These are the questions that we need to put, and we need to put them to government, and we need to know exactly who is responsible for this. There was something written down that the NHIS is trying to provide cancer care. Is there a way of integrating all of this to make it smoother and easier, so that if a person knows I'm an NHIS patient, I will have access to whatever care I need through both methods? Not that they have to apply to one here, apply to another there, and so that there's an integrated and easy way for cancer patients to access money. I understand you have to make applications, maybe through the internet, through the website. Do all of our indigent patients have access to the website? Do they even have email addresses? How do they have, how can they reach and get access to some of this care if they don't even have the tools or the wherewithal to make it?
Thank you. Now, that is, you see, for me, that leads me to where I'm going to be coming now, because next I'm trying to look at the how we navigate, especially as a patient, with all these rules, with all these supposed policies and procedures, because we do have them, and unfortunately, I'm struggling to actually understand how it helps just the everyday Nigerian. Our population is in 200 million, and we're talking about 1 billion. So, how do we work out the math? If the fund has 1 billion, okay.
I think, you see, as I said before, you see, we at the Healthcare Federation of Nigeria, we are pushing a lot for enabling environment for private healthcare, because we believe that the private healthcare system would actually go a long way, enabling the private healthcare system go a long way to providing adequate care for the country. We're a huge country, and as you mentioned, 200 million people. A lot of them, a huge population, part of that population, are living below the poverty line, living in rural areas, having difficulty accessing care. So when we're talking about how to make sure that these things are done, I think one of the key areas that a lot of countries have used is insurance, health insurance, making sure everyone has health insurance. And for those who cannot afford health insurance, using things like the sin tax to shore up that insurance, to make sure that those funds are available to provide healthcare for the indigent. And so that is, for me, the way that I believe we need to move forward, because that is a sure way of ensuring that people have care. Right now, I'm not in the government, so I can't tell you exactly what is going on. I am, looking at it from the outside, just as you are. And what I can say is that we as people from without can make demands of government for that transparency. We can make demands, particularly civil society, of government to say what is happening to that money, where is it, how is it being used? And as I said, we need to have someone we can hold responsible for those funds, because it is not clear exactly how people can access the funding. What they can get through things like the NHIS is clear. If you have NHIS registration, you can get what is available there. Lagos State has also just recently also come up with part of that they are also going to be responsible for some cancer care, although that in itself was also not as clearly defined as one would have loved. But this is what we're doing, and what we're talking about right now is closing the gap. This is what the World Cancer Day is all about. This is what we have to focus on and say, how do we close the gap? How do we make sure that people receive the care they need?
Thank you. Okay, so now, not last question, but I want to try and start to look at rapid. But does this cover? Does the funds? Does it cover treatment or all aspects of oncology? Because one of it for us that drive cancer awareness. For those of us that are focused predominantly on cancer awareness, the drive is we'll rather save lives, and to save lives means people need to know. So by educating the population on the little things that they can do right, we also have to be aware that we need good screening from opportunities, facilities, and all that. So does this cover that we've just talked about now, does it cover the treatment? Does it cover things like screening? Because I've already had a lot of conversation and understand that. I mean, I think it's the HPV that people pay for, which I didn't get that, because if we want to reduce death rates in cancer and we don't give just the vaccinations, make it at least available, nothing to do with whether I have money or not, then how are we going to bring down the numbers? And then the same way, how do we take care of those who need palliative care? Because the spectrum for cancer is the diagnostics, there's the screening, there's the screening. No, let me put it in order. There's a screening. So if we reduce screening numbers, we're at least making some progress. If we're diagnosing, the diagnoses are very good, we're getting up. And when we get to the palliative care, are we allowing people to gracefully go home, not in pain, without care, because it's not nice.
Yes, thank you for that question. Now, the fund is supposed to cover all aspects of treatment, but I don't know how far it goes in terms of palliative care. But the question you had asked earlier, is 1 billion enough? 1 billion is just the tip of the iceberg. We certainly need a lot more money and a lot more funding towards cancer care. And I think for people who are listening, I could just quickly, make a summary of what the issues were. In the past, we used to have a lot of issues with communicable diseases, and those were things like malaria and diarrhea and all those kinds of infections were major killers in our society. But whether with civilization, quote unquote, or the advancement of society, we are having a lot more what we call non-communicable diseases, which include things like diabetes, hypertension, cancer. And these are whether they're a result of the food we're eating, whether it's a result of the pollution that is in the air, they are increasing and increasing. And so things like cancer that were not a problem in our society before are becoming a huge problem, and it's only getting worse. And it's not just in Nigeria alone, it's globally. So it is something that we need to address. And so that 1 billion we're talking about is just the tip of the iceberg. It is just a small amount of what is actually needed for that kind of care. And it's good, as I said, for the NHIS to start looking into this, for the Lagos State and hopefully other state insurance coverage should also cover this, but there needs to be a lot more focus on how these things are being covered. And as you mentioned, palliative care. I'm not sure how much of palliative care is actually being considered, which is end of life care. What can we do for that? Is that also a part of what is being provided for? I'm not sure that is actually what is being provided for, but it's something that we need to push for, and we need to push for more funds to be made available for this condition.
Thank you, Dr. Pamela. I want to take it from a perspective, because I've had a lot of, I'm talking to you now today, and thank you for your time, but you have been in a position to make significant differences in this journey for driving change. That's how I put it. I'm going to use the word driving change, especially in the healthcare, or focusing on the healthcare. Now, in your role of when you were as the founding member of SynLab, yeah, how would you advise? Because I'm looking now at, we're trying to get the data for all the medical centers, so maybe we can help to navigate people to their different, where they can get access easily. One of the things I found is that we're looking at the work you've done outside of what we're talking about now, which impacts what we're talking about today. How would you navigate people or guide decision makers in understanding that, for instance, SynLab, where it is, yes, I know you were the founder, and I think you've moved on with that to different projects. Well done. How would you get people to understand that there are lots of spaces opportunities in the space to help impact change for cancer patients? Because there's a lot available now to help cancer patients, but we're not aware of it. Is it that we're not aware of it? Is it because it's too expensive? What exactly is the reason, or what in your view is the reason why? Do you get my question?
Yes, I do. Thank you. I think that what you're saying is so important, because cancer used to be a death diagnosis. Here you have cancer, you know it's over. That was a long time ago. Now cancer is considered curable. There are all sorts of what I would call tests and treatments, what they call targeted therapy. And what do I mean by that? Cancer is a proliferation of cells. Now, some of those cells have special markers on it, and a lot of research has gone into finding those markers to target those cells directly, because in the past, a lot of the treatment they were giving would kill the cancer, but kill healthy cells along with it. And that made it very, very, shall I say, dangerous for the patients actually receiving the therapy. But now they have targeted therapy. They have targeted therapy such that they can target the cancer and treat it, and it goes away. And if there's a rebound, they can just take your blood, check for the markers in the blood, and if the markers have changed, target it again with a different kind of treatment, and it goes, and treat it again. And that's where where control and even cure of cancer is being talked about. Now, the question is, one, do people know about it? No, people don't know enough about it. Lack of knowledge is what drove, our setting of the program, Doctors on Air, to actually give people an understanding of healthcare, of the things that they need to know about. And you can't say enough about it. Even insurance, people don't know what they're entitled to. You talked about screening. Most insurances actually have, screening as a benefit. But do people know about it? No. And if they don't know about it, how can they ask for it? So the first thing is education, education, education. People need to be aware of what their rights are, what their benefits are, and they need to demand for them. The second aspect is what you talked about again, is cost. These treatments, these targeted therapies, specialized therapies we're talking about, are not cheap, and they come in foreign exchange. And some of the costs are huge. And this is where the ramping up of insurance needs to happen. Because when you have a big pool of insurance funding, that is when you can afford to actually provide care, specific care for special people, and spend a lot of money on a few, because the money is being provided by a lot. And I think if we can work on these issues, making sure that whatever is collected for quote-unquote sin tax money actually goes into healthcare, goes into health insurance, builds up the pool to make sure that there's money available for cancer patients and other patients that need specialized care. But because we're talking about cancer patients today, we're talking about the people who need specialized care like this. And the fact is, it's not money being thrown away, because that, unfortunately, is the attitude of a lot of people. They're going to die anyway. No, they do not need to die. And if people realize that these are very productive members of society that are actually getting cancer, so it is important that we spend this money on the patient and trying as much as possible to achieve cure for them. I think it would go a long way to helping close the gap.
Honestly, Dr. Pamela, I won't say it in any other way. You have actually hit quite a lot of the key issues that are central to our discussion today. And I sincerely want to say thank you. I'm trying to find something that has come up before I end. Now, the Doctors on Air, just before I end, because I know you're an award winner on this your platform, on this your navigation, and I really have to put my hat up for you, because I live, as you know, with the disease. So it is very important for me that the right messages are sent and we try and navigate it to the patients directly. So in your last, give me 3 things that you would hope for us as Nigerians to be able to take away from this today in relation to moving forward and knowing how to get access. This is the last episode of our discussions for the World Cancer Month drive, and I want to know what we can take forward for 1 year, for the next 1 year.
First thing I'd like to tell people that screening is important. We all need to screen. The older we are, the more important it is. The second is that if you are a member who have insurance, health insurance, find out. You may not need to pay for it. It could be a benefit that's already there, that's just waiting for you to discover it. And once you discover it, please utilize it to the best of your ability. And the third thing is that we all need to shout out for health. We need to make sure that we are all asking for improvement in the healthcare sector. This is a personal, well, not a personal, but it's something I'm working on, which is the fact that,
okay. Sorry.
Which is the fact that we have a draft policy for improving healthcare incentives that is on the table right now that needs to be passed as a policy. There's a policy for improving aviation. There's a policy for improving, for incentives to improve agriculture. It is important that healthcare is given the same kind of priorities to make sure that healthcare is put as a priority in our country, because when healthcare is a priority, cancer is a priority, and all of us become a priority at the same time. Thank you.
I want to say a very big thank you to you for agreeing to join us this morning. Thank you for sharing your time with us. And above all, we look forward to actually seeing you again, because this discussion is not going away. And until we keep drumming it into the populace, we're never going to make an impact in saying, look, just follow, just do something, just ask for help, just find out where there is help. So I want to say thank you for joining us this morning, Dr. Pamela. Thank you for being on the space with us. And for those of you joining us, thank you all for joining us this morning. You can actually follow us on Common Cancer Foundation, any of our platforms, and get information from the website. And you can follow the work of Dr. Pamela Ajayi, because making a difference is a combination of a lot of things that we do. Doctors on Air is live. I have been on it, and it may help doctors on the platform who don't know where or how to find information to also be able to access help from your work that you do with the doctors. The doctors do make a difference to us. So I want to say a very big thank you to everyone this morning. Thank you for joining us, and we look forward to seeing you again next 2 weeks. Dr. Pamela, thank you.
Thank you very much.